Hello everybody, Dale Bethel, Bethel Law Corporation. What I'd like to do today is talk about Medi-Cal and long-term care planning in California specifically. One of the biggest issues that we confront is when do we want to start thinking about Medi-Cal? In other words, when is it appropriate? When should we get started? What are the things we need to notice? So what I'd like to do is kind of go through maybe you as a child out there wondering when you should come in and see me in order to talk about your parents. All right, so the first question has to do with what do you notice when things are changing at home in terms of behavior? One of the biggest issues that I always come across is that who is going to notice? Mostly the parents themselves are not going to notice that they're declining in terms of their cognitive ability or their physical ability to take care of things. You as children are going to be the first persons that notice that something's not quite right. So always, when it comes down to who's approaching me about this conversation, it's usually the children. In fact, it is you that, as a child, that are noticing that things are not quite up to snuff and things aren't quite getting done, and you want to talk about what to do in the future in terms of long-term care concerns. Now, one of my big issues is when the parents themselves actually come in to see me and start talking about long-term care. It's not unnatural for a well spouse to talk to me about their ill spouse, but there's always a but to it. It really boils down to where are the children. So when the parents actually walk in and start talking to me, one of the first questions I always want to know is, where's your children at? Because usually it's the children that are having the concerns way before the actual ill spouse, let alone even the well spouse noticing that something's not quite right. The next big question always comes up, when should we start worrying about this? I mean, that's what the children usually ask me. When should I be concerned about my parents? Well, it really boils down to watching their behavior. The normal process that we're going to go through is their cognitive decline. Are you noticing things that are not quite the same as what they used to be in terms of their functioning and making decisions? Of course, there's also the physical decline. That's something that we all can notice. But really what I'm getting at here is, are they able to, get a shower? Not so much physically, but are they just not willing to have a shower every day? Are they getting dressed like normal every single day? Are they getting out of the house every single day and doing normal things, say yard work, going to the grocery store on a timely basis? These are things that as we do get older, we stop to do. And so that's the beginning of thinking that maybe we should actually look into long-term care concerns. So with that, what are your long-term care options? The first thing you can do is nothing. If you do nothing to, solve this issue of long-term care, well, you're going to be privately paying. And some people may be able to do that or even want to do that. And so private pay is an actual option, but it will be very expensive. It's running around $8,000 to $12,000 per month, depending on the neighborhood you're at. Of course, the higher-end neighborhoods are going to have higher costs compared to the lower-end neighborhoods. The other issue is that you can always get long-term care insurance. Problem with long-term care insurance is it's expensive. And then I usually find with my clients who do have long-term care insurance, two issues. Number one, right before they actually need it, they cancel it because the premiums are getting so high they can't afford it. And so all the money that was spent previously on those premium insurances is just out the window. The other big issue with long-term care insurance is it may not be enough. When it finally gets down to it, maybe the long-term care insurance policy will only pay, you say, $4,000 a month and you need $8,000 a month. Well, the good news with that is if even though you do have that long-term care insurance that doesn't quite pay the full bill, Medi-Cal can be achieved and pay the remaining amount. A third option is to keep that parent at home. Now, I know everybody that comes in and sees me wants to keep their parent at home. They want to make the effort to take care of them. However, my experience after 30 years of doing this is it's not a good choice. It's very, very difficult to take care of an aging parent. It's not so much taking care of them every day, but everything in your household is affected. You know, the utility bills go up. Electricity is going to be on all the time, specifically with air conditioning and heating. Your TV is going to be on 24/7. There's other issues too in terms of water usage. Everything goes up. So before you sit there and make the noble effort of trying to take care of that parent, I think what you should do is go to option 4, which is the Medi-Cal. Lastly, you can always apply for Medi-Cal. In fact, that's what we do, and that's the reason for the video here. In qualifying for the Medi-Cal, please remember the certain things you can do to notice that it is time to actually talk to us, and we'll offer a free consultation for you to come in and see us, and we'd be happy to go over that issue so that the family now has a roadmap as to exactly what needs to be done in order to get that long-term care Medi-Cal to pay for it. Thank you for watching our video. Be sure to like, subscribe, and ring the bell, or watch other great videos that we may have.